feel like it makes all your worries go away, but the reality is you use it, you feel like that for a little bit, but all your problems are still there.
It's gotten so bad, the medical examiner is sounding the alarm. A new twist to the already deadly heroin crisis in Northeast Ohio, claiming even more lives tonight. 8 suspected heroin overdoses in 2 days, 3 of them deadly, a problem that has plagued Lorain County, now threatening lives in Cuyahoga County. Good evening, I'm Chris Flanagan.
And I'm Leon Bibb. The pain reliever fentanyl has been found in some of these cases, a drug with even deadlier consequences. News Channel 5's Kristen Volk joins us tonight. Why fentanyl?
Fentanyl only enhances the euphoric feeling that people get from using heroin. So addicts are mixing the two drugs, but the narcotic is 80 times more powerful than morphine. We spoke to 2 recovering users today who say they're not surprised by this trend.
When you're using, you mix things and experiment things. I've used pills with my heroin.
April spent 7 years injecting heroin up to 4 times a day. Sometimes the Cleveland resident mixed heroin with cocaine.
As much as you don't want to admit that, but it's just the reality of being an addict.
Her drug buddy was her sister, who she says still uses heroin and now laces it with the potent pain reliever fentanyl.
We would see it occasionally before this, but to see a cluster of it is a big, big concern.
That concern turned into reality this week for Cuyahoga County medical examiner Dr. Thomas Gilson. Out of the 3 people who died from a suspected heroin overdose in the county this week, 2 of them had fentanyl in their system.
If you look at how much more potent it is than heroin, somebody's really getting a product well above what they're expecting.
It's like a euphoria of like when you get high, the way it comes over you and just the way you feel good about everything.
Some people say it's like a mother's hug. It's comforting. You do forget about your problems.
Both April and Emma first got hooked on prescription painkillers in their 20s, but they turned to heroin for a cheaper, faster high. It's the same reason why doctors say so many other people get addicted too, and so many more are dying. In 2007, 40 people in Cuyahoga County overdosed on heroin. Compare that to last year when heroin took the lives of a whopping 195 people in the county. But April and Emma refused to be a part of that grim statistic.
This time I'm standing up for myself better, taking the steps I know that is going to help me and not worrying about what other people think. You know, I got to do what's healthy for me.
The medical examiner says they're seeing more women and people under 30 die from heroin overdose. The good news, though, is that the state health department says fewer teens are abusing painkillers and using heroin today. Chris and Leon?
Kristen, what can people do who are using heroin but really want help?
Well, first and foremost, they need to seek out their local treatment center. They are all over the city, all over the state. Secondly, there is a free program in Cleveland that teaches people about the drug naloxone. Naloxone is a drug that reverses overdoses. So we've got a website for you. It's up there on the TV right now. It is www.opiatecollaborative.cuyahoga.us. That's opiatecollaborative.cuyahoga.us.